That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. All right, we are back. Hello, everybody. Another episode of Real Health, where we teach you how to feel better, get stronger, live longer, and feel younger. This is Brandi. I am Amir, and I'm a chiropractor, and Brandi's my other half.
I do everything else.
That's it. And this is where we talk about the news regarding health and get you caught up on what's been going on in the past week. And also, we give you a wellness perspective on what all of that means and whether you should apply it to your life and how to process everything. So we have a lot of articles today. It's pretty neat. We got something about marijuana.
Which we did promise we would do some more
We talked about
last
that,
week.
yeah. So we've got one article on marijuana, and then there's some information about a new birth control pill. We've got we're talking about energy drinks. That was in the news with a certain famous person who is a wrestler, a boxer, an actor. Everybody knows who this guy is. And we'll talk about caffeine and detrimental effects of it. There's a story about a plastic surgeon that was doing some shady things and lost her license. We have information on carpal tunnel. I don't think we're going to get through all of this. We may save this for the next podcast. But then we also, aspartame was on the news recently, which is a sweetener that's found in diet drinks and
which has been
foods.
Around for a bazillion years.
Around for 50 years, yeah.
And I just wonder why we're just now learning and finally qualifying what it really is, which is a crappy toxin that is in so many things.
That's at the end of the pile. I don't know if we'll get to it today, but we will definitely talk. I think it's important to talk about it.
It's huge.
We may push that to the next podcast. But why don't we start with the marijuana one, and you can lead that one off.
That sounds great. So this one is from NBC News. ER visits for children sickened from marijuana surged during the pandemic. So this is not a surprise, right? Anytime something is...
Well, actually, I am surprised. Children are using marijuana.
Why are you surprised about that? Here's the thing. We are now saying, like in the state of Maryland, if you're over 21, you now have access to this. Really, they can go in, they can purchase whatever they want.
Well, within limit. But yeah, I know what you're saying, but that's not children. So
well, it's not children, but
how are they defining children? What age?
Well, they have different age brackets, so we'll break some of that down here in a second. But here's the thing: we have now opened it up to everyone to be able to, over a certain age or with medical challenges, and I don't think people are being cautious about where they're putting their stuff, right? Mm. Like anytime you have a pharmaceutical, anytime you have, something in your house, even firearms, that's a huge, topic, not necessarily health related, but there's so many differing views. And we just need to know, if you have that stuff, you need to be cautious. You think your kids don't know things. You think they don't have access to it.
Oh yeah, my dad had a gun, and he told me where it is. I could go access it whenever I wanted. I was probably, I don't know, 6, 7 years old, and he showed it to me. He taught me how to shoot it.
Well,
he said, it's right here, don't touch it. And I never touched it. But
right.
But yeah, I did.
But not every kid is like that, right?
You're right.
So sometimes we go, I'm not going to tell my kids it's here. They have no idea. And,
they probably know where it is.
They probably do. So the biggest jump, the article said, was among kids under the age of 11. And there was more than a 200% increase from 2019 to 2022, the CDC found. That is a huge increase, but we also need to know that when you have such small numbers, those increases, right, the percentage of increase is going to feel really high. So it says the number of young people consuming toxic levels of marijuana, edibles, or smoking pot to the point that they require emergency help shot up dramatically during the pandemic. This was reported by the CDC's last Thursday. The new data is concerning to pediatric emergency care doctors like Dr. Caleb Ward at Children's National Hospital in DC. So this is right in our backyard, people. But they're not surprised. They said it would be an unusual week if we weren't seeing children presenting to our emergency room with side effects from cannabis ingestion. So that's a little scary. So the majority of the increase is children under 11, right? But There was actually, it said, while older teens accounted for the vast majority of cannabis-related ER visits, the most stunning increase was found among children under 11. So the under 11, yep, was a 214% increase. That's crazy,
And they're
right?
saying it's because of the pandemic,
Well,
or it just happens to coincide.
well,
with
they're
the
saying that the increase of marijuana usage increased during the pandemic, right? Because how many people were diagnosed with anxiety conditions, depression, that's from being locked away in your home and not able to connect. We are built to be people who humans connect with people. That it affects our immune system, it
Pretty
affects
much
our
every
mental health.
species is designed like that.
Well, it was since we're just focusing on humans, that's where that came from.
Okay.
So it's a little sad. One of the things that they say is contributing to this is the marketing of said products. So if anyone has seen any of the cannabis related products, the packaging is vibrant, beautiful, fun. A lot of their edibles they're making to their brownies and cookies and drinks and all sorts lollipops. So they're all items that kids wouldn't know the difference, right? So they see something laying around that says brownie. Well, if we were to leave something in our kitchen or around our house that said brownie, I guarantee you our
If the
children,
kids don't get it, the dog will get it.
for sure. The dog probably could use a little calming down. So I don't know if I would complain about that, but the kids would be a different story. So I think it's something that we need to just be vigilant about. We need to be watching our kids, watching where we're putting things. I'm not necessarily against someone using certain products for health related issues. I know my mother had cancer. If I were older and could go back in time, it's something I probably would have recommended for her to combat the nausea that occurs with some of the cancer treatments that people do. So I'm not an all out person who goes, I hate this stuff. I don't think it should ever be there, but I do think that people need to be cautious. I think there are conditions people don't know about. In researching this, it made me remember one of my best friends. They have somebody in their life that for sure had used a lot of marijuana over many, many, many years. And there was a condition that he was misdiagnosed for a long time, and he was really sick, and it was called cannabinoid hyperemesis syndrome. And so people who use high levels of marijuana over long periods of time in their life can be susceptible to this condition.
Yeah. Hyperemesis is uncontrolled vomiting.
Oh, thank you for correcting my pronunciation. I'm not schooled as you are.
I don't know if I said it right either.
So, but yeah, it creates really severe bouts of nausea and vomiting. It's extremely painful. I know his was misdiagnosed for a very long time.
Yeah.
It's
ironic, right? Because
right.
marijuana, THC, is an anti-nausea,
correct,
right? Which suppresses vomiting, but when you get poisoned by it too much over a long period of time, now you can't stop vomiting.
Yeah.
Which I can't imagine anything. Everybody's had food poisoning.
Oh my gosh!
So this is like food poisoning that lasts longer than 12 to 24 hours.
And I was told for him in particular, it was horrific. It was worse than any bout of food poisoning, that he's experienced.
I mean, you had morning sickness all day long
for 4 months.
Every kid. So.
Yeah. So now. That's obviously extreme. It's a rare condition, but oddly, what's funny with this condition is you may not know for like a while. Symptoms are very mild initially.
Yeah.
They can be passed off as something else, and so you may not know until it's really bad. And then at that point, you just have to stop using. That's the only way to get rid of it.
It's hard to get rid of it too, and it has to be diagnosed correctly. I don't want to spend too much time on this, but at the same time, I want to make sure the reason we're spending the time on it is because it is legal in so many states now. Recreational use is legal in lots of states, and medical use is legal in even more states. And people with medical cards usually buy this stuff and share it with their friends and family, and still do the recreational
While
stuff.
that's
So
not legal, we'd like to point out, and we don't recommend that.
we don't recommend it, but it's being done, and you just have to be careful. So if you're using THC, remember, high doses over a long period of time can make you extremely sick. And we're not even talking about short-term like
Yeah, we're
things
talking
that
about,
it
yeah.
does, where it
Well, and let's
impairs
also,
function and cognitive function and so on.
I do want to just put these out there. There are some things, if you have these items in your house, be watching your kids, like lock them up, be safe. But here are some things that you need to know. Some things that may be signs and symptoms that your kids may have gotten into something. For children, let's see, what was it? Ataxia, agitation, dysphoria, somnolence, paranoia.
So ataxia is an inability to walk, abnormal movement.
Perfect.
Somnolence is frequent, is lots of sleepiness.
Yeah. So those are things you'll want to look for. Respiratory depression, seizures, and of course, in very severe cases, coma. So be watching for those things.
Kids shouldn't be taking it.
They should not. So there we go.
Nice.
Next.
All right, moving on, changing gears, shifting directions. We're going to talk about birth control. And now that there's an over-the-counter birth control pill approved by the FDA, this article came out from NBC News also, Women's Health. It says the Food and Drug Administration's decision Thursday to approve the country's first non-prescription oral contraceptive is expected to expand birth control access to millions of people. It's called Opil. It hits shelves in early 2024. We don't know exactly when, but that's what the manufacturer says. It's approved by the FDA to be on store shelves like any other over-the-counter medication, such as Tylenol, is what the article says.
This makes me a little nervous.
Where exactly the product will sit in a store will be at retailers' discretion. So some retailers may just put it on a shelf on their family planning section. Some may decide they want to lock it up, like cigarettes, or keep it behind a counter. Some are saying that maybe it should be in the pharmacist's area and they should actually ask the pharmacist for it. And so actually there are some states where the pharmacist is allowed
to
prescribe birth control
Well,
pill, not the doctor.
I mean, in reality, we do know that the pharmacists have the corner on knowledge on
Yeah, I think in this country, I think we underutilize pharmacists.
I 100% agree.
I mean, these are doctors who've spent 4 years of higher education above their bachelor's degree. So they had to get the basic science. They have to get the bachelor's degree. Now they have a doctorate in pharmacology, and they're sitting behind a counter counting pills.
Right.
It's ridiculous.
Yeah.
They're underutilized. They're underpaid, and the whole society's missing out. And you know where we get our pharmaceutical information is from ads,
Right.
and drug reps,
Right.
who don't have the education.
Correct.
This is awful.
Yeah.
And in fact, we're one of 2 nations in the world where we're allowed to advertise for drugs, prescription drugs, on TV.
Yeah.
All but 2 countries allow this.
So what does that lead to? That leads to consumers self-diagnosing,
Right.
walking into their doctor's office,
Right.
and going, I need this. What about
Right.
this, doc?
Right.
And most doctors, I would say, are going to be super cautious, but not every doctor is created equally,
Yep.
just like not every chiropractor is created equally.
It's true.
And so you're going to hit times where they are going to be giving things out that they should not
Yeah.
be giving out.
So let me tell you about the drug. The FDA first approved Opil as a prescription birth control in 1973. So at least this thing's been
This has
around
been around a really long
for,
time.
50 years. Pfizer marketed it for more than 30 years under the name Ovret before marketing was discontinued. And it was discontinued solely because of business reasons. They say business reasons, but I think it's because the patent ran out.
Probably.
Most drugs have a patent life, and once that patent runs out, others can copy that drug and so on. Now, most patents are supposed to be like 4, 5, 10 years.
Yeah.
Drug patents can last 30 years. So it's billions of dollars. Anyways, that's a different conversation.
Very different conversation.
It has been found to be 93% effective in preventing pregnancy. So that's odd, to 93%. Where did they get that number? I mean, did they have 100 people take it and 7 of them got pregnant?
I have
Because that
no idea.
93 doesn't seem. I don't know.
I mean, that 7% is going to be super upset,
Yeah,
and that's a big number,
especially
really.
I'm envisioning. Forgive me for the disturbing image. But I'm envisioning a 13-year-old
Yes,
kid
going in,
going
getting
in, picking
this.
it up, start taking it.
Right,
They don't know how to take it properly
right.
because you still have to have your cycles. You have to stop, and allow for. But it probably has the sugar pills, so during your
Correct.
cycle you stop. But still, I mean, and then they're assuming that the minute they take the first one, I think you have to take it for a month before it becomes effective.
There's a lot. They're assuming that the person, child, kid, teen, adult is going to be reading the information that's being sent with the prescription or
Yeah.
with the over the counter. They're probably not. We're in the medical field. We know how many people don't read the information we
Right.
give them, right?
Yeah.
And so it's, I mean, most adults aren't reading it. You cannot expect a kid to read it nor understand it. And then let's also then talk about who's telling them about contraindications, who's telling them about risks, who's telling them, hey, by the way, when you get sick and your doctor goes ahead and prescribes an antibiotic for you, and they didn't bother telling you or asking if you're on birth control because, well, you're 12.
Well, because when they do your health history, they only ask you, are you on any prescription drugs? They really don't ask you if you're on non-prescription drugs. And now this has become a
over the counter.
over-the-counter
So
thing.
it's going to get missed. And what happens when you're on an antibiotic and you're on birth control? Well, it can render the birth control ineffective, right?
Yep.
And there are other things that can do that too.
Right.
So people need to know these things.
Yeah, please be careful. Please be careful. And again, it's kind of like the marijuana thing, make sure your kids aren't picking up stuff and taking them. Let's move on to the energy drinks and caffeine.
Well, this definitely sparked my interest when I saw this come through as one of the articles we're going to be talking about because, our kids like hydration drinks. Now, we don't let them drink energy drinks, right?
Right.
But there's this particular company that, that this article is about. Well, part of their challenge is that they're marketing it. Their marketing material and packaging looks very similar to the
Correct.
hydration.
Correct. And it even though they say under age of 18 you shouldn't consume this, the marketing seems to be geared towards children.
Right.
So this is Logan Paul's Prime Energy drink under scrutiny over high caffeine content. I think everybody knows Logan Paul, YouTuber. He has 23.5 million subscribers just on YouTube. Very popular guy. A lot of people just love him, follow him. I haven't seen much of his content, but
I don't know much about him.
I saw him. I watched him box.
Oh, okay.
He's a good boxer. He's right now part-time a wrestler with the WWE. So he does a lot of fun things. But so here's how it started. Senator Chuck Schumer, the majority leader, has asked the FDA to investigate a popular beverage created by the YouTube influencer Logan Paul and KSI, that guy's a rapper, over its high caffeine content. The release of Prime, that's the name of the drink, a drink brand founded by the YouTube personality and boxer Logan Paul, and had British teenagers lining up for hours outside grocery stores on its release date in December. Some supermarkets were even forced to limit purchases to one bottle per customer. Now Prime is facing a backlash from physicians and lawmakers who say that the high levels of caffeine in one of its drinks can be harmful for children. So there's two drinks, like you said. One is for hydration,
and there's no caffeine in that
sports, and then the other one is the energy one. Caffeine levels equivalent to about 6 12-ounce cans of Coca-Cola.
Yeah. I think it's 200. Am I right? If I'm remembering right, 200 milligrams of caffeine.
Yeah, it contains 200 milligrams of caffeine compared with the 114 milligrams of caffeine in a 12-ounce can of Red Bull, or the 100 milligrams found in a cup of coffee. Pediatricians recommend that children under the age of 12 avoid caffeine entirely, and those from 12 to 18 should consume no more than 100 milligrams per day.
Right.
So,
I mean, we don't realize here's a little funny story. When we had our final child,
our third child,
Cyrus, he while I was nursing, I was taking in some caffeine, and we have a coffee that we really love, which has a bit higher caffeine content, but it's a super clean, like very low toxin in it. And so we love that. So I wasn't drinking as much of it as I would normally, but I was still drinking more. Cyrus became very
Irritable.
irritable and just not easy to, he was just not an easy kid for a
Yeah.
while, and we could not figure it
He wouldn't
out.
fall asleep.
Started doing some research, and he just seemed like something was in his skin. Like he was fuzzy, uncomfortable. And come to find out, I was over caffeinating our baby.
Yeah.
Like it was
Through breast milk.
through breast milk. So, because come to find out, the half-life of
I don't
caffeine.
want him to think you were feeding the baby
Right.
coffee.
Yeah, it was one sip for me, one sip for him. But it was. I'm so glad that we did the research,
Yeah.
because the half-life of caffeine in infant is far different than.
Yeah, I believe in adults, human adults, is 3 hours.
And
is
people may not
half-life.
know what a half-life is.
Half-life means half of it is gone in 3 hours. So if the half-life is 3 hours, that means half of it is gone in 3 hours.
How quickly your body
so
processes
if you
it.
drink coffee at 3 p.m., at 6 p.m., 3 hours later, half of that caffeine is still in you. A cup of coffee is 100 milligrams of caffeine. So 3 hours later, 6 p.m., 50 milligrams are still in your system. 3 more hours, 25 milligrams are still in your system. Right. And so it goes down by half. So that's what half-life is. It typically is used to measure radioactivity. So like uranium, has a half-life, short half-life. So anyways, coming back to caffeine, in newborns, that half-life was 36 hours.
Yeah. So every day I was taking on more caffeine, and it was just building up to a toxicity level.
Yeah. It's building up. Like
he's fine now. I did not ruin him permanently.
Yeah.
He's good.
Yeah. I mean, I know how you define fine in kids.
He's great.
He's smart. He's happy. Yeah. Healthy.
He's having a birthday.
Over the past 5 years, sales in the energy drink industry have surged from 12 billion to 19 billion. So it's big industry.
Huge
12
industry.
To 19 billion just energy drinks. So the caffeine can disrupt the sleep cycle, which is essential in a child's developing brain. That's why kids need more sleep than adults, because their brains are developing. High caffeine consumption can also give consumers the jitters, cause digestive issues, headaches, heart palpitations, even abnormal heart rhythms. So it's interesting, because the articles focused on kids, but I'm like, man, this would mess up adults too, and the elderly. Like,
huge.
Our patient base is probably, more than half is, I don't know, over 50.
Mm-hmm.
And which I'm not going to say is old, because
he's just a few years shy.
In 1 year, I'll be there. In 1 year and 2 months,
right.
I'll be 50. So, but
I'm much younger.
One of the things that happens, caffeine gives a boost, and then a crash follows. That crash can be dangerous. Also, grown-ups are the ones, well, I guess teenagers do this too. They mix these energy drinks with alcohol.
Oh, it's so
which
dangerous.
is an upper and a downer, which damages their heart.
Yep.
Long term. And then you've got older people who want energy. So the reason I said our patient base is older is because a lot of them complain about lack of energy. There's one of the reasons they come see us.
Right.
It's like, I want more energy.
Right.
And so some of them are living on these energy drinks, or they drink a awful amount of coffee.
So if you're tired, go back and listen to the article, the podcast we talked about hydrogen.
That's right. That was the episode where we talked about poor air quality,
Mm-hmm.
and we talked about hydrogen pills that you can put in water to increase energy levels. Canada also is thinking about recalling Prime Energy over caffeine levels. Canadian health officials are preparing, this was in BBC News, preparing to recall Prime Energy, a popular drink promoted by social media influencer, over concerns the product exceeds the acceptable caffeine limits. It's interesting. The one in Canada has 180 milligrams. The one in US has 200.
But I think I did hear something, and I have to double check this, but I don't think they actually serve Canada. Like, I think it's been brought in like under wraps.
Okay, interesting.
So yeah, so very interesting.
But in the article there was a comparison, and this is kind of neat. Prime Energy, 200 milligrams of caffeine. Red Bull, has 80 milligrams in a smaller container. So Monster has 160 milligrams per container, but their container is larger. Their container is 470 milliliters. Coca-Cola has 32, so that's the lowest. Brewed coffee, 135, roughly 100 milligrams in a cup, and black tea is between 30 and 50 milligrams of caffeine.
And let's just say that the only issue in these energy drinks being caffeine is really not the case. So as detrimental as caffeine is, I think some of the bigger challenges in some of these drinks is how they're sweetened. And I think we have an article about that. I don't know if we'll get to it today.
Yeah, aspartame was in the news recently.
Finally.
But caffeine, like the other article said, can damage the heart and blood vessels.
Yeah.
Harmful for children and young adults, lead to issues with heart rhythm and blood pressure. And then I think elderly who have blood pressure issues, they need to be extremely careful also. So energy drinks, I think they taste good. I found a little image that shows how much caffeine is in Dunkin' Donuts coffee. I tried to find one for Starbucks as well, because I know if you're America runs on Dunkin'.
That's the tag for sure.
But anyways, there was one. This is interesting. A large frozen coffee had 393 milligrams, which is double. So we're worried about recalling this prime drink, but people are getting large frozen coffee at famous coffee shops, and
Yes.
I'm not promoting or bashing any of them. Please, I go to both, so Starbucks and Dunkin', but I prefer to make my own coffee. But this large frozen coffee, 393, is tremendous.
And let's face it, here in America, most of them are not having just one a day. I can tell you, I know in one of my prior lives when I was not living nearly as healthy, because I didn't know what I know now, and I was younger, so I thought I was invincible. So when I was teaching computer courses, I would often drink 160 ounces of coffee before noon.
Wow.
Just put that in your head. And that was drip coffee,
That's 10 16-ounce cups.
Yes.
That's a lot.
It was way too much, so I probably
A
don't
large
even need it.
Americano has 371 milligrams. An X-large hot coffee at Dunkin' has 330 milligrams. So, decaf. X-large decaf has 18 milligrams. So you really can't get anything without
water. Water's a great alternative if you
hot
want some
chocolate
caffeine-free.
had 19. An X-large hot chocolate at Dunkin' had 19 milligrams, so that's very small. Either way, that's just a little side note. Let's finish up with this article, and do you want to do carpal tunnel, or do you want to talk about? Let's do carpal tunnel real quick.
Okay.
So this article is from U.S. News by Health Day, and the title is "Could Carpal Tunnel Syndrome Fuel Heart Failure Risk?" Heart failure is so scary. Here's what the article says. New research from Germany shows that the common nerve disorder carpal tunnel syndrome, CTS, may be a harbinger for heart failure among older folks. In a study of 164,000 people, that's not a small number.
No.
Because the city of Frederick has, 70,000? 65,000?
We're right
so this
there.
is like
Growing
almost
rapidly.
3 times the size of the city of Frederick, where we live. 164,000 people. Those 60 years or older who had the condition, which they're talking about carpal tunnel syndrome, which causes pain, weakness, and numbness in the hand and wrist, had nearly a 50% higher risk for heart failure. But they don't know what the link is. They just said this number seems to
right
look
now
like the
it's
other
more
one.
like, this is interesting.
It says there's no proof that one causes the other, and the findings should not cause patients with carpal tunnel to panic. There's no direct link between them. Carpal tunnel affects between 3 and 6% of adults, according to the American Academy of Family Physicians, and just over 6 million adult Americans have heart failure, according to U.S. Centers for Disease Control and Prevention, CDC. So this other study in Germany looked at about 82,000 Germans who were first diagnosed with carpal tunnel between 2005 and 2020, and the same number without carpal tunnel. So they looked at that's where they got the 164,000 people. Is half of them had carpal tunnel, half of them didn't,
Yeah,
because they wanted to compare the two. Go ahead.
I just struggle with some of these tests because my first thing that I always think of is, were those 100,000 plus people, were they also on various medications? What were their other comorbidities? What were,
Yeah.
because we all know that any of those things will change how the body truly functions. So
Yeah, I feel like this was a big waste of time and money.
I know, because I go,
Absolutely big
they
waste.
got nothing from it.
I mean, so it says average age of both groups was 53. About 2/3 were women. All were then tracked for about a decade to identify which patients also ended up being diagnosed with heart failure. In the end, no risk association of any kind was seen among patients under the age 60. Well, clearly, I mean, most heart failure is after the age of 60,
Which is what they say, too.
right? The research team did, however, find a clear risk among patients 60 and up. In that age group, 6.2% of non-carpal tunnel syndrome patients were ultimately diagnosed with heart failure, compared with 8.4% of people who had. So the people who didn't have carpal tunnel syndrome, 6% of them had heart failure.
Mhm.
And people who had carpal tunnel syndrome, 8% had heart failure. So you go, okay, maybe the treatment for carpal tunnel is what caused it. What's the treatment? And so are they saying that now if you have carpal tunnel syndrome, we're going to put you on heart medication too?
Well, that's probably the most concerning thing, is that it feels like a stretch to create the link, right? And now are we going to have a drug that's going to step in and be
Yeah.
the saving grace for this, and it's not even really a problem?
Yeah, I don't even see the point of this study. I don't see the point of the article. I don't see why I don't know why we're reporting on this.
Yeah,
I
that's a
don't.
great
So,
question.
I'm just kidding. I know why we're reporting on it is because there are nerves that go from your neck to your hand. There's a lot of times it's called double crush syndrome, where the nerve is not just interfered here in the wrist. So there's a median nerve right here. There's a tunnel right there called a carpal tunnel. There's a retinaculum on top of it. And when the tendons get swollen and inflamed by doing repetitive movements like cashiers or people type a lot, then the tunnel becomes narrow and it impinges on the nerve, and it makes your hand weak and numb and painful. And but sometimes it's not just that. That nerve can be impinged in the elbow, in the shoulder, or in the neck. And a lot of times the nerves that come out of the neck is because you have bad posture. Well, forward head posture impinges the nerves to the arm and hand, but also it impinges just below it in the upper thoracic spine, the nerves
Right.
that go to the heart. And that's called a cardiopulmonary nerve that comes out of the upper thoracic spine, upper back, just below the neck. And if there's nerve interference in the spine in that area, it can mimic carpal tunnel, and it can affect function of the heart.
Now that's a study I would like to see.
There you go. There you go. Hopefully they're listening. Um, even the article says this requires further study. Yeah, this what a waste. How much money did you spend on this study? Let's do it really quick. I know
Yeah,
we're
I
out of
think
time.
this one was really, I mean, it's sad and it's a little comical
But
because
there isn't much to report on. A plastic surgeon who live streamed procedures on TikTok, banned from practicing medicine in Ohio. An Ohio plastic surgeon's state medical license has been permanently revoked after a medical board determined she harmed patients while live streaming their surgery on the social media app TikTok. This was from U.S. News. The Ohio board voted to ban Catherine Grau, also known as Dr. Roxy.
it's a nice name.
What a nickname. Catherine to Roxy. Her plastic surgery practice, Roxy Plastic Surgery, and to many TikTok followers, that's how she's known, from ever practicing again in the state. Board said Grau, who originally had her license suspended in November, neglected her patients as she live streamed parts of her procedures, spoke into the camera, and answered viewers' questions, all while the surgeries were taking place.
Well, while So let me just say this. While there definitely sounds like there's some negligence, and some things that were not correct, this is not, it's not new. I mean, in teaching hospitals, right? We're live streaming surgical procedures often.
That's true.
And we're doing it through teaching, and we're answering questions while we're doing it. So I think when I look at that, I go, did she have the patient's consent to do it first?
Good point.
Because if she had the patient's consent and they understood what was going on, there really is, I don't see what the problem would have been. Now, she's also had some not great results, right? So there's been some.
It says the notice also listed 3 patients of Graz who suffered severe complications and needed intense medical care after she operated on them. One woman's intestine was found to be perforated a week after her surgery, a procedure that Grau partially live streamed on TikTok.
So, I mean, we know how these articles can be poised to make somebody look really bad.
It's
And
true.
I am not saying I know who she is, or I've never seen any of her procedures done, but we also have to go, it's not the first time people have answered questions. They do it, surgeons do it all the time while they're teaching, all the time. Negative results come from surgeries often.
It's true.
Right? We don't know if there's a true correlation between the two, but it just so happens the negative one that she had, you know what I mean,
Yeah.
also was one that she was
we don't know
partially
if
live
it's 3
streaming.
out of how many, and we don't know if there were
Correct.
other issues and so on. But the one that they're talking about suffered some serious stuff.
Yeah, they did.
Bacterial infections
should
in
never
the
happen.
abdomen, loss of brain function.
Yeah.
Because of the toxins and so on. But who knows? That might have happened even if she wasn't live streaming. So I get your point.
But investigate, don't agree to something,
Right.
If you're not comfortable. If you want your doctor focused just on you,
Yeah.
don't allow those other things.
Bottom line, surgery is
A risk.
invasive. There's always a risk. There's risk with anesthesia and cutting and bacteria and infections and all of that. And so it's if you choose, and plastic surgery is always elective.
It is.
So if you choose to do plastic surgery, pick your surgeon correctly and do your due diligence. I think we had a good podcast.
I think it was fun.
Now we did want to talk about sweeteners in drinks, diet drinks, and so on. So I'm going to save these. Let's talk about these next week.
We'll do it
On our next podcast. And I think that was great. Hopefully you found it useful. Please subscribe. What else do we want them to do?
Share it with your friends.
Share it. Comment. Let us know what you're thinking.
Yeah.
And,
Thank you for those that have. We enjoy reading
we
those.
enjoy your comments. Absolutely. We'll keep bringing you the news. We'll keep bringing you the wellness perspective. And we'll be back next week. God bless you. Take care.
Thanks.